Good morning. Good morning. This is Dr. Yonette. I am so happy to be with you this morning. Look, I have some work being done on my roof, so if you hear some thumping in the background, just ignore it. I can't wait to post the picture that I have selected for our contest. Please look for it on my story and send me your response so you can win the skincare set. The skincare set. I'm giving away a fabulous skincare set to help mothers and grandmoms and whoever, grandpas and husbands and dads, so that you can have yourself taken care of as you take care of baby. So how is baby doing today? I know you must be excited about your baby's growth and development. Yay! You are doing a fabulous job, doing your best to raise a successful, well-rounded child. And of course, I'm here to help. So call on me, send me your questions, send me your comments, send me, your ideas so I can discuss the topics that you're interested in. So some time ago, I talked about autism spectrum disorder. And as time goes by, I will share some strategies that you can use to help your child if he or she is diagnosed with ASD. Today, I want to address Down syndrome based on information that's provided by the CDC. So, what is Down syndrome? Down syndrome occurs in a child when a child is born with an extra chromosome. So chromosomes are really like bunches of genes that are in your body, and they dictate how you grow, how you develop, and what happens to you throughout life. So in a normally developing child, that child will be born with 46 chromosomes. Babies who have Down syndrome have an extra copy of chromosome. So they have 21, or it's chromosome 21 or trisomy 21. Now, because of the extra chromosome that those babies may have, the brain development is impacted, and this can lead to both mental and physical challenges in the body. Babies with Down syndrome also may have a similar appearance, but they have different abilities. Their IQs might range from mildly to moderately low, and they may take a longer time to talk than children who are developing normally. So what are some of the common features that you will notice in a baby with Down syndrome? Flattened head or face, especially the bridge of the nose. That child may have an almond-shaped eyes that slant upward, the shortness of the neck. You may have small ears. You may see that the child has a tongue that protrudes, tend to stick out of the mouth, sometimes to the side, sometimes to the front. They may have tiny white spots on the iris or the color part of the eye. They'd have small hands and small feet, a single line across the palm of the hand. The palmar crease, they would have a single line. See, you have 3 lines. They would have one single line. And small pinky fingers that sometimes curve towards the thumb. Small pinky fingers that curve towards the thumb. They'd have poor muscle tone or loose joints. And you may notice that the child would have be shorter in height than normal children, or as an adult than normal adults. So these are some of the features that are common in children with Down syndrome. Now, let's talk about the babies. How many babies are born with this disorder? Down syndrome is really the most common chromosomal condition diagnosed in the US. Each year, about 6,000 babies are born with Down syndrome. And this means that Down syndrome occurs in about 1 in every 700 babies. Now, we normally say Down syndrome, and we just blanket it. But there are really three different types of Down syndrome. The three types are um, trisomy 21, where about 95% of people with Down syndrome normally have this condition. And this type of Down syndrome, each cell in the body has three separate copies of chromosome 21 instead of the usual two copies. Then you have translocation Down syndrome, and this type occurs for a small group of people, a small group of babies, when an extra part of a whole extra chromosome 21 is present, but it is attached or translocated to a different chromosome. And then we have mosaic Down syndrome, and this occurs again in a small percentage of people, like 2%, and you have a mixture or a combination of what I mentioned earlier. Now, what are the risk factors to having a child with Down syndrome? Now, the extra chromosome 21 leads to physical features, like I mentioned earlier, and developmental challenges in your baby, in your child. Um, and so researchers have found that Down syndrome is caused by this extra chromosome, but no one knows for sure why it occurs or how many different factors play in the role of making it occur. But we know that one factor that increases the risk of having a baby with Down syndrome is the mother's age. So mostly women who are 35 years or older, and when they become pregnant, a lot of them, or they are more likely to have babies who are affected by Down syndrome than women who are much younger. However, the majority of babies with Down syndrome are born to mothers less than 35 years old. But there are many more births among younger women. So you have, it looks like, more older women having the babies with this condition. So how do you get the diagnosis for your baby? How is it diagnosed? I mean, apart from seeing the physical features and becoming suspect of your baby having the condition, how is it normally diagnosed? There are two basic tests that are available to detect the Down syndrome during pregnancy. There's screening test and diagnostic test. The screening test can tell a woman and her healthcare provider whether her pregnancy has a lower or higher chance of Down syndrome. Screening tests do not provide absolute diagnosis though, but they are safer for the mother and the developing baby. Diagnostic tests, on the other hand, typically detect whether or not a baby will have Down syndrome, but they can be more risky for the mother and the developing baby. So neither the screening test nor the diagnostic test can predict the full impact of Down syndrome on a baby. And nobody can until the child is born and you're interacting with the child. What are some of the health problems now that this child may have? He or she is not going to have the normal developmental milestones that we have been talking about. But let's talk about some of the problems that if you ended up having a child with Down syndrome, what are some of the health problems that you can expect, and then how you can manage them? Many people with Down syndrome have the common facial features. You look at a child and you know the child has Down syndrome, but they may have no other major birth defects. However, there are some people who may have one or more birth defects and then other medical conditions. And some of the more common health conditions that you will find among children with Down syndrome are hearing loss, obstructive sleep apnea, which is a condition where the person is breathing temporarily, the person's breathing stops temporarily while they're asleep, ear infections, eye diseases. A lot of children with Down syndrome wear glasses, and then they may have heart defects, which will be present at birth. But your healthcare provider will routinely manage your child for these conditions so that care can be provided. Here are some of the treatment options. Down syndrome, I want you to know, is a lifelong condition, and there is nothing that you can do to cure it. Services, though, at the early stage of life, I always talk about early intervention, will help babies and the children with Down syndrome to improve their physical and their intellectual abilities. Most of these services will help your children develop their speech, their fine motor skills, their physical or gross motor skills, and so your child may have to interact with a professional like myself, an occupational therapist, a physical therapist, a speech pathologist. And these services are normally provided through early intervention programs in each state. So children with Down syndrome may also have difficulty with attention in school. And although this might be the case, your child may end up being in a regular education classroom, or he or she, depending on the level of disability that he or she is experiencing, may end up being in a learning for independence classroom or a special education classroom. Now, I see a lot of kids with Down syndrome in my practice, and they are the sweetest, loving children that you can ever interact with. So if God blessed you with a child who has Down syndrome, love on that child. Give him or her the best options in life, the best opportunities to succeed. Devote your life to making this child's life worthwhile, because having a condition does not mean that you have to be different. It just means that you have to work in areas where other people would not normally work. And so I am here to provide input and strategies and help you along the way as you journal about your child with Down syndrome, as you journal about his growth and the development, and you share with us your experiences as a mom, as a dad, raising a child with Down syndrome. Life can be complicated and complex, but in the midst of those complexities, I want you to know that you are not alone. We are here as professionals and friends to work with you and to support you. So reach out. Join my Skincare Explosion Facebook group. Subscribe to my YouTube channel. Follow me on Instagram. And I promise I am going to be here to help you through your journey of raising your child with Down syndrome. Remember, tomorrow is our play date. Tomorrow is our play group time, play group number 2. So be on the alert. Be ready to join me at 7:30 for a half an hour playtime with baby. And remember to take part in the contest. The contest is going to close on Friday. I'm going to pick the winner on Friday and send you your skincare package so that you can be beautiful. You can take care of you while you take care of baby. This is Dr. Yonette. Thank you so much for joining me today, and have a great day.